Croydon is a vibrant South London borough with a diverse population of 1/3 people. Rates of smoking amongst the population are comparable with the national average at around 21%. There is a great deal of geographical variation though, with smoking prevalence in some of the poorer parts of Croydon at about 33%. Smoking tobacco is the biggest preventable cause of ill health and mortality in society, killing in excess of 80,000 people each year. In Croydon, around 450 people die from smoking annually. In addition, there is a huge financial burden to the economy in terms of the costs of treating smoking-related illness, productivity lost due to increased sickness rates and smoke breaks at work, house fires from smoking materials, and even litter removal. Estimates suggest that in Croydon, smoking costs between £80 and £110 million each year. As in other UK boroughs, the NHS in Croydon provides free stop smoking services for people who live or work locally. The Department of Health sets each borough targets for the number of people these services must help to quit smoking each year. Note that the target is not for the number of people who receive support from the service, but the number of people to have a successful outcome. So those clients who are not successful in quitting smoking do not count towards the target. And as most people know, quitting smoking is not easy. At its inception in 2001, Croydon's own stop smoking service enjoyed a few years of success with regard to its target for 4-week quits. For the first 3 years, the target was met, if by increasingly smaller margins. However, though the service increased its annual outturn healthily and consistently in the early years, it couldn't keep up with the exponential year-on-year uplift of Department of Health targets. Over a 5-year period, the target increased from 220 4-week quits in the year 2001 to 2002 to over 10 times this quantity by 2005 to 2006. In the year 2004 to 2005, the gap was seriously widening between target and outturn, and after performance briefly plateaued, it began to fall away from 2005 to 2006. After a significant drop in 4-week quits delivered by the Stop Smoking Service in 2006 to 2007, the Primary Care Trust decided to investigate solutions to address these disappointing results.
One of the first things that they did was increase the budget to £1 million a year. Coupled with this was an increase in the size of the staff team, and that increased from 4 staff members up to 9 staff members. And then over the next 12 months there was a whole lot of things that we did to try and improve the local picture on smoking cessation. One of the foremost of which was creating a Tobacco Control Alliance.
The Tobacco Control Alliance is what I call is the essential networking ingredient, bringing all the service providers together and the commissioners together. And without a very good working relationship, without a very good understanding, the service doesn't really kind of work to its optimum level. You also get an opportunity to meet other providers and learn from their experiences and see if they learn from yours, and it's a sort of cross-fertilisation of ideas.
A social marketing strategy and action plan were devised, including a whole range of street marketing events and publicity events, and that was to increase service awareness, of course. And yes, I had to dress up as a giant cigarette, which is still a career high point for me.
A service rebrand and a huge distribution campaign of over 65,000 promotional leaflets and posters took place in Croydon. Stop smoking service interventions at the local hospital were upscaled. A programme of successful clinics was held at the local authority premises at Taberner House, providing smoking cessation interventions for council staff.
We had loads and loads of themed campaigns too. For instance, we did a Quit and Get Fit campaign, whereby if you quit smoking with our service, you got free vouchers for the gym. And that was based on the assumption that people like to make lots of life changes at the same time. We also did a Quit and Win campaign, and people who quit smoking with the Quit and Win campaign were entered into a prize draw and could win health-related prizes, things like a bicycle, and there was a Wii Fit, and all this stuff helped create a bit of a buzz.
In a pubs and clubs campaign targeting people smoking outside venues, a branded cigarette lighter was produced. Unlike a leaflet, these inexpensive resources were likely to be kept by smokers for a week or two, delivering the quitting message every time they lit up.
We didn't just work with the public, we also worked to encourage our advisors in the community as well. And we instituted performance benchmarking systems, identifying best and worst performers, making sure those that were performing really well were getting validation, and those that were struggling got support. We also had a newsletter that we'd circulate 4 times a year as well, with features and hints and tips and profiles of advisors who were doing really well. And that included performance feedback tables as well, which was something new, so people could just see how they were doing in terms of the context of the whole borough.
A healthy living hub for Croydon was created at the local library, offering street-level walk-in access to stop smoking services for the first time. An independent provider, Solutions for Health, was contracted to contribute 500 4-week quits per year. This contract is now in its 3rd year. This raft of measures couldn't come soon enough to arrest the downward trajectory of the service in the year 2008 to 2009, though the momentum seemed to have slowed. It was in the following year that a radical impact from all this work was felt. In 2009 to 2010, the service delivered its highest ever outturn to the tune of 1,604 4-week quits. This was almost 2.5 times the 2008 to 2009 figure.
Well, in 2010-2011 we had our best year on record, and Croydon got the target for the first time in 7 years. We managed 2,184 4-week quits of a target of 1,915. So we actually exceeded the target by about 250 quits. But you know, most of the credit, as far as I'm concerned, goes to the kind of community advisors in pharmacies and GPs practices, because you know they really kind of ran with this.
Over the last couple of years, the Stop Smoking network's been strengthened, and there's been a lot more communication. So we now have the quarterly newsletters, and we have the regular meetings, and the networking is really useful. There's also been the level of competition introduced so that people are ranked, and I think that's made quite a big difference between some of the advisors to sort of see if they can beat their neighbour.
In the ever-changing landscape of the modern NHS, it is difficult to predict what kinds of services will best meet local needs in the Croydon of the future. What is clear is that right now there is continuing need for measures that drive down smoking prevalence. Croydon continues to innovate, and recently an online face-to-face service has been launched, allowing the housebound to access smoking cessation services from the comfort of their own homes via the internet. This is the first of its kind in the country.